Hello guys, welcome to our channel PKR Vibes Career and Growth. Today we are discussing about the denial CO 249 in medical billing. This denial stating that this claim has been identified as a readmission. So here the doctor given service to the patient and whatever he given service, the doctor submit a medical claim with the complete procedures or treatment to the insurance company, and that claim insurance company processed the claim and they denied, stating that this claim identified as a readmission. At the time, as a AR caller, what kind of analysis you would like to do on that claim before calling to insurance as a pre-call analysis? And if you are calling to insurance, what kind of questions you will be asking to the insurance representative as a AR caller? And what kind of corrective actions you would like to take as a final action on that claim? Nothing but what kind of resolution you are giving to the claim to make that denial into the payment. That all steps we will discuss in this video. Before that guys, if you are watching our video first time, if you not yet subscribed, could you please subscribe our channel PKR Vibes Career and Growth, and turn on the notification so that you will get every our video as a notifications to your mobile or your desktop. Okay guys, now we are discussing about pre-call analysis for readmission denial in a medical billing. First we have to know what is readmission. By name, we can understand easily a readmission is nothing but when a patient joined or a patient admitted back to hospital within a short period after being discharged for a same kind of reason or related condition is known as a readmission. So, why readmissions will happen by the patient is might be because of the reason. Mostly reason is the treatment was not uh, done by the doctor completely, or the complications, like for example already doctor provided some guidance how to use the medications, but patient is not followed as a doctor suggestion. The way of taking prescriptions, I mean drugs, as per prescriptions was not done. So in that way also readmissions happens, or otherwise there are a few conditions which is not related to the previous discharges also. So here the reason whatever might be, the patient is not feeling well. So for the treatment again he was joined to the doctor, I mean to the hospital, to get a treatment from the doctor again within a short period. Nothing but the discharge by the patient and again the admission by the patient was done within a short period. Commonly it is a 30 days. It will be known as a readmissions. So, whenever a medical claim is submitted to the insurance processed and they denied the claim, that this claim was denied for, the reason is the patient was identified as a readmission. That's why we are not giving any payments to you on this claim, because we already processed this kind of claim previously. We already paid, mostly for example within 30 days. Prior to 30 days, we already processed the same kind of claim service, and already we given payments to doctor. Again you are submitted this claim, so that's why we are identified this claim as a readmission claim. So that is why we denied the claim. We denied giving the payments to doctor. At the time, as a AR caller, what kind of pre-call analysis we should take for readmission denial, we will discuss now. For example, we submitted a medical claim to insurance and we does not got any response, or we does not receive any response from the insurance. As a AR caller representative, before calling to insurance, you should have to do a basic analysis on a claim. Like you should have to verify available internal sources. What are the internal sources? We are working for doctors, right? On behalf of doctors, we are working. Our sources is nothing but our doctor software, nothing but practice management system, PMS we can call it. So we have to check in doctor software, does we receive any EOB from the insurance or not. For example, we does not receive any response from the insurance, our job is to alternate thing is we have to check the internal doctors clearing houses. What is clearing house? It is an entity or software to submit the electronic claims, e-claims or electronic claims to the insurances. So tracking purpose and the status, whether it was received by the insurance or not, everything we can understand in a clearinghouse. So we should have to check our internal clearinghouse if we are not found any status in our PMS. And unfortunately, we are not received any status or not found any status in our clearinghouses or in our PMS. Then our last source to verify the claim status before calling to insurance is we have to verify the respective insurance portal to get any claim details or claim status. So, like that, we should have to verify our internal sources before calling to insurance. That is known as a pre-call analysis. For example, the second scenario is already we submitted, we received nothing but doctor received, and also that doctor received EOB, that EOB along with the denied code CO 249, nothing but this claim is denied or identified as a readmission. So that EOB already posted. Then what kind of analysis you should have to do on a claim? Then you should have to verify what is the previous DOS billing and payment history. So we already denied code is there. Before calling to insurance, we should have to verify, does we build this kind of services previously? If we build, we got a payment for this claim or not. So if we build again, we are submitting this claim within the 30 days or after 30 days, or we are submitting this claim along with the condition codes or not. So this kind of information we should have to aware that before calling to insurance we should have to verify this kind of details. So these are the very basic pre-call analysis for a readmission denial. Okay guys, now we are discussing about AR caller on call steps for readmission denial. So as we discussed, if no denied EOB found from our side and we don't found any claim status from our internal sources, then our first question is like this: may I know the claim status, please? But you have to start the call like this: hi, this is Thomas calling from provider's office checking on a claim status. So like this, you have to start your call for the scenario if you doesn't have any UOB from our side. If a denied UOB received from the insurance and a denied UOB was posted in our PMS with the denial code CO 249, your question might be slight different because we know the status, it was denied from the insurance. Then our question might be like this: hi, this is Thomas, I'm calling from provider's office taking on a denied clarification, please. Because yes, we got a denial, but we want clarification why this denial was denied. And yeah, the next question is, they will provide the denial clarification like the rep will provide like this claim was denied for readmission. Then you have to ask the insurance representative. The question, next question is, may I know the initial admission date? So initially, when we are submitted claim to the insurance, we need to do a pre-call analysis. But if you are not get that information, or if you want some more clarity, you should have to ask this question, no problem. May I know the initial admission date? At the time, the insurance representative will provide you the initial admission date on the call, and you have to verify and also ask the question, may I know the readmission dates? For example, For example, the claim was submitted before, I mean, initial admission is, and the readmission days is within the less 30 days. Then how can you identify these days if you are verified over the phone call and understanding the days duration? Then you can understand. So initial admission date is before 30 days, for example. Now again we resubmitted within the 30 days. Then readmission days, if the insurance provided 30 days, but we are readmitted this claim as a 20 days or 15 days within the 30 days, then denial is true. So that's what we need to compare initial admission and also the readmission dates. And if you're good at, you should have to understand what kind of diagnosis we build at the readmission time, and again, I mean, at the initial admission time, and also again now what kind of diagnosis we build. You can understand whether we have a similar kind of services or not if you are good at analysis by reading medical records and also observing the claim form by verifying the diagnosis codes and a procedure code. And I given one more point: probe on call to reprocess the claim if already claim billed with the condition codes like B4 and 47 on a medical claim form. Guys, this condition I given if you are working on a institutional claims like UB4 claim forms, or we can also call it as a CMS 1450 claim form. In field location locators are boxes 18 to 28 on UB4 claim form, hospital billing claim form. We can observe the condition codes. For example, already your denied claim is having B4 condition code on field locations. That B4 condition code is telling to the insurance that admission is unrelated to the prior discharge. So whatever we submitted the claim right now is not related to the previous discharge. So we want payment. So how can you probe this information if you are opening the claim form and if you are observing the claim was submitted along with the resubmission code, I mean sorry, along with the admission code, I mean condition code, then you can probe this. Or sometimes the condition codes 47 also available, means readmission after discharge. So after completely discharge and we are uh, completely following our medications or follow-ups with the doctors, after that again it was a fresh readmission. So like that, these codes are giving additional information to the insurance to process the claims towards the payments. So if already these codes are available, as a AR caller representative, your job is to probe this information over the phone call and request the claim for reprocess. If they are reprocess the claim, take the call reference number and a reprocess reference number for the next follow. And here the next one is may know the corrected claim submission details. For example, there is no condition codes available on a claim form. Then your next action, final action is may know the corrected claim submission details and also appeal submission details. Means corrected claim mailing address and corrected claim timely filing limit. And what is the appeals mailing address and appeals timely filing limit. And if it is denied, you will be already no need to take claim number. If there is no denial, you will be available. Take a claim number and call reference number. So these are the basic questions you need to over the phone call. You need to verify and clarify over the phone call with the insurance representative for a readmission denial. So guys, now we are discussing about end actions for readmission denial in a medical billing. The first action I given for this CO 249 denial is you have to resubmit the claim. Why I given this action code means if you are calling and you are telling this claim was denied for readmission at that time, you got to know that this was claim again submitted within the 30 days period to the prior discharge. At the time, insurance representative suggest us that we can submit this claim after 30 days. It's very rare, and at the time we have to just take a suggestion. After 30 days, we have to submit the claim again. And the second point I given is you have to reprocess the claim. So this is possible when means if there is already condition codes are available on claim form, that condition codes telling that this admission was not related to prior discharge. Based on that information or probing part, we can reprocess the claim. This is also one kind of action will be possible on this scenario. This is also like rare, means if already there, they are telling that okay, if nothing is there, okay, it's okay. If already available, it's okay. And also it is a valid, then it is they will reprocess. That's why it's rare. And the third one is it's a very common action. Everyone is getting action is you have to task to coding assistance or coding review. For example, what kind of coders will do on this kind of claims means they will verify the medical records, they will verify the previous discharge, and they will verify what are the diagnosis and what are the medical conditions as a present we are filing as a readmission. If possible, they will correct the condition codes, or condition codes are missing, there are no conditions codes and a resubmission claim, they will they will append or they will add valid condition codes based on readmission things. So like that the coder will do a review on a claim and they will make the necessary changes accordingly and they will submit the corrected claim accordingly. So that is why the tasking to coding is a good action on this denial. As a final, we have to appeal to insurance to prove the medical necessity. It's the last action on a claim. Nothing but you may be able to appeal by showing the second admission was for a different condition. It is not the same condition to the prior discharge. So with complete medical records and supporting documents, you should have to do a appeal to prove the medical necessity. So these are the very basic actions on a readmission denial. Guys, if you felt content is useful, could you please like our video so that it will reach us many more needy people who are looking this kind of content. Thank you so much for your time and have a good health. Bye for now.